Back to our channel. Now we are going to start the cubital fossa today. So let us start our discussion on cubital fossa. Actually, the cubital fossa is a triangular hollow space. So if you see, this is forming a triangular space. So first you need to understand the location where it's present. So to understand that this is arm, this is forearm. So for example, if you show in my hand, then it will be clear. So that so this is how the cubital fossa looks. So actually it is present in between arm and forearm junction, right? So it's actually a triangular area and it is having an apex and the base. So if you observe in my hand now, the base is situated towards upside, whereas apex is downward, right? So base is upward and the apex is downward. So if you see like that, then you can understand the exact location, because in the diagram you can't understand it that much. So actually this cubital fossa is triangular hollow situated in front of elbow, exactly in front of elbow, and it's homologous with popliteal fossa. Actually popliteal fossa is present on posterior side of your knee joint, right? We'll discuss that in our lower limb anatomy, right? So this cubital fossa in the upper limb is homologous with the popliteal fossa of the lower limb, right? So we will understand now what are the boundaries of this cubital fossa. So coming to the boundaries, on the lateral side you will have the medial border of brachioradialis. So first we'll mention what are the lateral sides and what are the medial sides, okay? So actually this is the lateral side and this is the medial side of the cubital fossa. So here we'll have the arm, here we'll have the forearm. So mainly on the lateral side you will find this is the cubital fossa, right? This triangular area. So on lateral side you will find the medial border of brachioradialis muscle. Brachioradialis muscle, why? Because from the arm you will get the brachial radialis towards the radius muscle, so the name brachioradialis. So brachioradialis medial border forms the lateral side of the cubital fossa. Next, coming to the medial side. The medial side is formed by lateral border of pronator teres. So you can see this is a pronator teres muscle. Okay. Next, coming to the base. So the base is actually an imaginary line, right? It is an imaginary line joining the two epicondyles. So you know, in our arm we have two epicondyles, lateral epicondyle and medial epicondyle of humerus. So this both epicondyles of humerus joined by means of an imaginary line, and this forms the base of the cubital fossa. So it's just like a triangle. You know, triangle will have base, apex, medial side, lateral side. So just remember anytime whenever you get the word cubital fossa, triangle, just remember the triangle and remember the major two muscles, that is the brachioradialis and the pronator teres. Okay, so only two muscles are participating in formation of this cubital fossa, mainly brachioradialis and also pronator teres. Done. Now we will understand about the roof. Roof is nothing but, of course, the skin. For example, if you see in my hand, you can imagine this roof. This roof is nothing but the skin. The skin which is present upon it. For example, the skin which is present upon it is nothing but forming the roof of the cubital fossa. So in this diagram, you can see what are the structures in the roof. So actually, the roof of cubital fossa is formed by skin upon it, right? First the layer skin. So if you remove the skin, next you will have the superficial fascia. Especially the superficial fascia also have a median cubital vein. If you see, this is a median cubital vein, right? And also you'll have the lateral cutaneous nerve of forearm. So this is the lateral cutaneous nerve of forearm, this yellow color one, lateral cutaneous nerve of forearm, right? And you will also see the medial cutaneous nerve of forearm. So this one is medial cutaneous nerve of forearm. And one more thing which you need to observe is, if you remember the superficial veins lecture, right? The superficial veins are nothing but the cephalic vein and the basilic vein. Cephalic vein is always on the lateral side, basilic vein is on the medial side, right? So how to remember that the basilic vein is on medial side? Always remember like base. On the medial side, if I arm, for example, this is medial side of my arm, so you can see I'm putting like a base on the medial side of the arm. So the base side is a basilic vein and the lateral side is a cephalic vein. So the lateral cutaneous nerve of forearm is running along with the cephalic vein. The medial cutaneous nerve of forearm is running along with the basilic vein. In the middle you will have the median cubital vein. So these are all the structures you can see in the roof of cubital fossa, right? Next, after the superficial fascia, you will go deeper, you will get the deep fascia, and after the deep fascia, you will see the bicipital aponeurosis. So from where actually it's forming? The bicipital aponeurosis is actually a continuation tendon. A tendon only later converts into sheet-like structure that is called as aponeurosis. Hence the name bicipital, because it's coming from biceps brachii muscle tendon. The biceps brachii muscle have a tendon which is in the form of sheet, and that forms a bicipital aponeurosis. So this is about the roof. So till now we have understood the cubital fossa is a triangular area. It has an apex, it has a base, it has a lateral side, it has a medial border, right? Once again let us recall everything. What are the two muscles on the sides? You have on the medial side pronator teres, and on lateral side you will have the brachioradialis muscle, right? So by these two muscles only this cubital fossa is forming. So the apex is mainly formed by meeting point of the pronator teres and brachioradialis, right? And the lateral border is formed by medial border of brachioradialis, and the medial border is formed by lateral border of pronator teres, and the base is formed by imaginary line which is joining the two epicondyles. Then, so this is about cubital fossa, and now we are seeing about the roof, right? Roof means upper part. So in the roof, first if you see, you'll have the skin. So after removal of the skin, you'll have superficial fascia. That too, in that superficial fascia you'll find the medial cubital vein, and also you'll find the lateral cutaneous nerve of forearm, and also you'll find the medial cutaneous nerve of forearm. So after the superficial fascia you'll have the deep fascia. After the deep fascia you have a special structure here, that is the bicipital aponeurosis, which is nothing but the continuation tendon of the biceps brachii muscle, which is an anterior compartment muscle of a arm, right? Now we'll talk about the floor. Okay, so floor is that actually that thing you need to imagine by yourself. Otherwise yeah, you can see here this one. Here we'll try to show the floor, right? So actually the floor of cubital fossa is formed by brachialis muscle and supinator muscle. So if you see the brachialis muscle, the supinator muscle, so these are the two muscles which are forming the floor of the cubital fossa. So if you remember, two muscles which are forming the roof of the, not only roof, they form this triangular area, right? What are those two muscles? On lateral side brachioradialis, on medial side you will have the pronator teres, right? Whereas on the floor you have mainly brachialis muscle. That thing you need to remember. On the floor you have brachialis muscle and also supinator muscle. So if you see, this is the floor of the cubital fossa. You'll have brachialis, supinator. Okay. Now we'll move on to the important things like what are the structures which are passing in the cubital fossa. So here we will find out the contents of the cubital fossa. So to remember the content of cubital fossa, already I discussed in previous video. You can remember the word, the mnemonic MBBR, not MBBS. Remember MBBR. So M stands for actually the median nerve, right? So here it will be, you can see median nerve and its branches, right? And B stands for brachial artery. So this is the brachial artery. Actually this order is from medial side to lateral side. Okay, so on medial side you'll have medial nerve and its branches, and next B stands for the brachial artery, and other B stands for the biceps brachii tendon. So you can see this green color structure, this is the biceps brachii tendon, right? And after that you'll see R stands for the radial nerve and its branches. So MBBR from medial to lateral side. Once again let us revise: the median nerve and its branches, next comes the brachial artery, next comes the biceps brachii tendon, next comes the radial nerve. So two nerves you have, median nerve, radial nerve, you have one brachial artery, and you have one biceps brachii aponeurosis, right? Tendon. And one more thing, if you observe this cubital fossa, it's looking like somewhat narrow structure, right? Very narrow, and the contents are described only after retracting the boundaries from medial to lateral side. So as we discuss the median now, mainly it gives its branches to the flexor carpi radialis. So the median now gives its branches to the flexor carpi radialis and also to palmaris longus, flexor digitorum superficialis, and leaves the fossa by passing between two heads of pronator teres. So to all those muscles it will supply. That is about median now. Next, the termination of brachial artery and the beginning of radial and ulnar artery. You know that brachial artery will further divide into radial and ulnar arteries. This also lies in the cubital fossa. And the radial artery is smaller and more superficial when compared with ulnar. You can see this is the radial artery. It's actually smaller and also more superficial when compared with the ulnar artery, and it gives off its radial recurrent branch. So the ulnar artery goes deep to both heads of pronator teres and runs downwards and medially. So if you see here, this is ulnar artery, it's moving deeper to the tendon if you see, whereas the radial artery is superficial, right, when compared with ulnar artery. And this ulnar artery goes deep between the heads of pronator teres and runs downward and medially, being separated from median now. It's being separated from median now by means of a deep head of pronator teres. So pronator teres deep head separates the median nerve from the ulnar artery. Okay, and later in turn it gives the anterior ulnar recurrent and also posterior ulnar recurrent and common interosseous branches. So remember, this ulnar artery will in turn divide into anterior ulnar collateral and posterior ulnar collateral and also common interosseous branches, which divides into again anterior and posterior interosseous artery and later give off interosseous recurrent branch. So regarding this collateral recurrent branch, we already discussed in elbow joint and anastomosis, right? So now we will talk about the tendon of biceps brachii. So the tendon of biceps brachii is with the bicipital aponeurosis. Okay. Next, coming to the radial nerve and its branches, right? They are accompanied by radial collateral artery and appear in the gap between the brachialis medially. So if you see medially, you will have the brachialis and brachioradialis and extensor carpi radialis longus laterally. Extensor carpi, I'll show it in another diagram. So you can see here the radial nerve. This is the medial side, this is the lateral side. Okay, how I'm saying it's medial lateral, because lateral side you find the radial nerve, right? So if you see, the medial nerve is between the biceps brachii and the brachioradialis muscle. So lateral to the radial nerve you'll find brachioradialis medial side, and medial to the radial nerve you'll find the lateral border of biceps brachii. Okay, so if you see, this radial nerve is passing in between muscles, so it is called as intermuscular nerve, as it's passing in between the two muscles. Okay, and at the level of lateral epicondyle it gives off posterior interosseous nerve. So at the level of this lateral epicondyle it gives posterior interosseous nerve or deep branch of radial nerve, which leaves the fossa mainly by piercing the supinator muscle. So here you can see this is the supinator muscle and this is the posterior interosseous nerve, right? So by piercing the, as we said, the radial nerve, now it's converted into posterior interosseous nerves or deep branches which are piercing the supinator muscle. You can see in this diagram, this yellow one piercing this supinator muscle, right? So piercing the supinator muscle, the remaining superficial branch runs in front of forearm or some distance. So that's it. By this we completed the cubital fossa. So it's actually very simple topic. You no need to remember all this, like what are the different features of this MBBR intern. Only remember the mnemonic MBBR which are contents. Just remember the borders, just remember the floor and roof. That's enough. So next topic is about posterior compartment.